The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Ageless Health live stream. I'm Dr. Tom and I got a great program for you. It's kind of a continuation, if you will, of the path that we've been touching on over the last several weeks. This is important that you understand a lot of the things that are taking place in our world, meaning, post-COVID, if you will. And we're going to touch upon something that has exactly to do with that, what it has to do with cancers. September the 11th at the Roselle Center for Healing in Fairfax, we're going to be doing a night on thermographic imaging and the diagnostics of potential problems with breast cancers. And so remember, I've said that this is a topic that affects not only women, but also men. Why is that? Guys, your prostate and breast tissue is genetically the same. So they have the same attractability to different noxious stimuli, bad things that happen to it, right? And we've gone into that just a little bit. We're going to touch upon it just a little bit. What I really want you to get is that, years ago, when it came to certain types of cancers, it was isolated on male and female. In today's world, and with the advent of being able to see how certain things affect the body, we know that breast cancers are related to prostate cancers and the same frequencies and high levels. But here's the deal. Breast cancers in men, as I've said, repetitively over time, were unheard of. And today, depending on your author, 1% up to some authors will stretch as far as 5% of all breast cancers are male. Why? Simply because of what we just talked about, that genetic tag from prostate tissue to breast tissue is the same. So the things that affect prostate cancer and breast cancer are similar crossovers. And we're going to talk about that a little bit. So what we're going to get into today, we're going to talk about something called turbo cancers. And you say, what is a turbo cancer? I've never heard of that. I've heard about breast cancer and prostate cancer and pancreatic cancer and lung cancer and colon cancer. But what the heck is a turbo cancer? A turbo cancer is a sudden development of cancers that nobody would have thought about up until, oh my God, recently some stuff is happening. So could it have to do with anything, if you will, that has come about since COVID? Dare I say that? Well, I will. But turbo cancer is, if you read it up, you go in turbo cancer, you're going to see anti-vax theory, right? Well, not so much. It's an actual situation that if you do the research, if you go to journals like Nature, if you go to the Townsend Letter, if you go to PubMed, and you really start digging and you start looking across, just don't read the thing that says, fact check, no proof, right? No proof that it's happening. Well, if you talk to your docs, and you ask them, are you seeing more different types of cancers today than you have in the past? Virtually all of them that deal with this sort of thing are going to say, yeah, absolutely. And you ask them why, they're going to kind of shrug and say, I don't know, because they don't want to put their nose on the line and say it might have to do with something else. But, these turbo cancers that they're going to say is an anti-vaccination conspiracy theory. I love to say that, right? Because it makes no damn sense. It's somebody trying to shut down the information. But turbo cancers, the thing that is that they're saying that it's a misuse situation. But go to Europe and let's, because there's so much that's coming out of there that's truth that's not here. And even the CDC, our government, is saying that the jabs have caused about a 14,000% increase in the sudden onset of different types of cancers. So if that's the case, don't you think we better pay attention to what might be going on and what might be able to be done about them? So here's the deal. a turbo cancer, right, is purportedly a very aggressive, in your face, oh my God, where did it come from? And what are we going to do about it? But all of a sudden it's going to metastatic. It's in stage 4. It's going to the tissues. It's going to the bones. It's going to the other parts of the body, and they just show up. I've seen too much of it now over the last couple of years. And as a result of that, it's got my attention, but to places, what can we do about it? And if you go in and you go into the stories that are reported to VAERS, VAERS, which is the Vaccine Adverse Event Reporting System, you're going to find that they're going to say that the data that is piled up by the anti-vaccine people is, to be taken with a grain of salt. Not so much when you really start digging deeper. But the cancers that are reported to VAERS following even influenza shots, the daily flu, could serve as a baseline, if you will, if you compare cancers now that are coming about as a result of post-COVID-19 vaccinations. And so what it says, and here's as they say, something to think about. People in their 30s reported just one cancer case due to influenza vaccination between January 1 and March 29th of this year, of 2024. All right, you ready for the next piece? Where 141 cancer cases were reported among people in their 30s due to COVID-19 vaccinations. That's a 14,000% increase in cancer cases. And those are the ones that, by the way, are being reported. And everybody knows, and your physicians know, that the VAERS reporting station is volunteer. So you have some people that, they're going to go on and report. A doctor might go on and report. But the majority of people that come up with different types of adverse effects due to vaccines are not reporting it, or they're sucking it up, or the doctors put it away and they say, whatever, right? Take that into consideration when you start thinking about these numbers. Are the numbers accurate? Are they minimized, or are they exaggerated? In this particular situation, knowing what we know about vaccination reactions and that they're voluntary reactions, voluntary reporting, and that we know that historically it's not even close to the numbers that are out there. So if that's the case, you got to take what we're talking about today very seriously. If you've had a vaccine, if you've had the J&J, if you had Moderna, if you had Pfizer, whatever, you have, in my opinion, based on the information that's coming out, in my opinion, you are at a greater risk for developing things that you don't want to have. So the next piece is there a way to handle these things, prevent it, but importantly, is there a way to diagnose it before it becomes something that's going to take your life? Well, the short answer is more than likely there's always a way. And that's what we're digging into. And that's why we're doing this for you. But more importantly, this is why September the 11th, when we do the program in-house at the Roselle Center for Healing in Fairfax, we're going to be talking about this specific situation. We're going to do it from a diagnostic point of view. Dareth Painter, who will be my guest next week on this program, we're going to talk a little bit about that thermographic imaging pattern. Dareth is going to show you why thermographic imaging can show things as they begin to develop and say, hey, and it's not a standalone. And she'll tell you this. Thermographic imaging is amazing as far as I'm concerned. It's unbelievable because it gives you the lead on, say, something's there. Now let's go find out specifically, if we need to, what it is. And maybe we can do something before we have to do cut and chemistry and all those things to be able to reverse something. But knowing what we know about these crazy turbo cancers that are out there, would it be great to have all the data and the information that is important so you can really be proactive in your own health? So turbo cancer, if you will, is a term it uses in many different articles. And basically what it is something that just pops up out of nowhere, and it's very virulent and it happens very quickly. So if you go to, I think, let me check it out, the April 15th, 2024 of this year, the CDC warned that COVID-19 vaccines have caused, and I said earlier, 14,000% increase in turbo cancers across the United States. That's from the CDC, the God of almighty healthcare platforms. Don't get me started on that. So there's an interesting video, and I'm going to give you both answers. So misuse of data is what they're finger pointing and say by the CDC does not constitute, if you will, a CDC warning. Did you hear what I said? Misuse of data. Well, that's a lot of bull. So when they want to prove something, they say, well, the CDC says it's so, and the FDA perpetuates it. So, but here's the deal. There's a video purportedly a significant guy see when they use the word purportedly, right? And I'm reading this to you right now. A Swedish pathologist by the name Ute Kruger, Kruger. And, he is largely responsible for the term that we're using right now. And there was a video that was produced by a group of COVID-19 vaccine skeptics, and they're known as the COVID Doctors for Ethics. Interesting, right? So I put it out there for you to go check it out, see what you can find out about this, and see if it makes sense. Dr. Kruger thought that these turbo cancers, and she calls them, by the way, were due to delayed doctor appointments from COVID lockdowns, but the period is long over now, as you know, right? It's gone. So this is, like I said, I give you both ends of the story. This is one that they're saying, it may not be, it's just because people didn't get to the doc and, so forth and so on. Well, what we're seeing is that's a lot of garbage. It really isn't the case, that there are far more exponential cancers that suddenly show up that were not there. So check that out and make sure you understand that these things are rising exponentially, and you really need to know the truth about what's taking place. So we're going to get into a little bit about, what can be done and the natural treatments that might be available to stop this nonsense. There's all kinds of things that you have to draw your attention to. So what's causing these breast cancers? When you deal with a patient that comes in and they say, my doctor found a lump in my breast. When you're dealing with the patient says that, I'm scheduled for surgery and chemotherapeutics, and they ask me, are there any other options that may work? So I have to put it in this position. There are other ways of increasing your immune system, and there's a lot of data out there that says that people who have done certain things increase their ability to recover. Now, what did I just say? What I said is that there's a lot of things out there that may be supportive. Somebody asked me, do you treat breast cancer? I'm going to tell you, no, I don't. But I treat your body's ability, your immune system, to support the decisions that you make relative to the type of direction you're going to take. There's many different types of breast cancers, right? From ductal carcinomas, they call it in situ. You'll see the sign says DCIS. There's cancers that are infiltrating ductal carcinoma, and those are IDC. Everybody likes these damn alphabets today, but that's what they mean. Then you have an ILC, an infiltrating lobular carcinoma, and then you have an infiltrating breast cancer, and then an invasive infiltrating breast cancer, and then you have a medullary carcinoma, and you have a male breast cancer, and then and that male breast cancer can be the same as all those other things too, by the way. It depends on the hormone balance. And we can go on, and you have mucus, and you have papillary, and you have triple negative breast cancer, and you have tubular carcinoma, and yada, 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 yada. And then they can even break it down, right? And these common forms, you have an adenocarcinoma. It's the most common type of breast cancer that you can deal with. And it basically It's found in the glands of the ducts and the lobules, inside the breast. That's where it goes. You have a Paget's disease of the nipple. Well, Paget's disease, if you hear it that way, is a bone expansion cancer. It's a rare cancer in this situation. And it forms in the ducts of the breast and spreads into the nipple, into the round circular areola of the nipple. Then you have the inflammatory breast cancer, and that's only found in a very small percentage, thank God. And then you have the angiosarcoma, and that's exceedingly a rare type. But in proximity, those are the things that we're dealing with. So why are we doing this program? Why are we doing a program on the 11th at the Roselle Center for Healing on thermographic imaging of breast cancers? Because look, going back to 2019, not today, but 2019, the incidence rates of new cancers, invasive cancers in women, were 268,600 new cases per year. Did you hear what I just said? 268,600 new cases per year. When you look at that, you better take a big, really? I didn't know that. And so we have to assume, based on the information that's coming back, that you'll go into VAERS. If we've got a 14,000% increase in breast cancer, what is that number really? What's really going on? So we look at people coming in, and there's a lot of predispositions. Now, we'll ask a patient because we're going to support their immune system, right? That's what we do. Alcohol consumption is a triggering mechanism for breast cancer. Breast implants. If you have a silicone breast implant, or the bag is silicone and it breaks, silicone is known to stimulate the formation of cancer. A family history of breast cancer. Now, Angelina Jolie went out and had her breasts removed and had all those things done to stop that genetic expression of BRCA markers 1 and 2. But it's really not about that. It's about, yes, if you have a predisposition, but we know today genetically you can take something that's predisposing and make it not predisposing anymore by doing certain. That's a whole topic that I could get into for about 5 hours with you and teach you how to do that. Maybe I'll touch upon it on the 11th when you come in, and Derek's going to talk about the imaging, the diagnostic patterns, and what it looks like, and how you can identify it, why it's so important. But I'm going to give you some of the other pieces of the puzzle. You know me. I'm the guy that's going to rattle and say, hey, think about this, do this, think about that, do that. And you'll see what's going on. So if you're too heavy, you got too much weight on you, you could be a skinny fat person. Why is that important? Because fat holds on to what we call aromatase. That's an estrogen tag. So, and then lack of physical activity. You're just kind of hanging out all the time and you never get out and even go for a walk, because that circulation of the lymphatic chain has to be ongoing. Water, a little bit of exercise, eating the right things, and you flush and move all this stuff out of there. So if you're post-menopause, you're at higher risk. Why? Simply because your estrogen progesterone balances at that point are way out of line. If you're in a constant state of fight flight, if you're in sympathetic overdrive, the chances are progesterone is going to be tagged down. So what's that got to do with anything? It has to do with the fact that progesterone buffers estrogen. Estrogen is problematic in of itself. If your estrogen level is too high and there's not enough buffering with progesterone, I'm giving you the simplistic pattern on this, you're very susceptible to this thing. So let's roll it back to these turbo cancers that we're talking about. So if suddenly, you should be examining your breasts on a regular basis and there's a lump that wasn't there before, it's a sign, better get checked out, right? It's also, you got a discharge from your nipple, and particularly if there's a little blood to it. Don't hesitate, get it checked now. If there is breast pain that wasn't there before, most breast cancers, as they start, are not painful. But if they go invade the tissue, the chances are that they will become at least uncomfortable. Any kind of lump in your armpit, right underneath here. If you got lumps and bumps in those areas, got a problem. If you have any peeling on the breast tissue or the nipple, it's a problem. So we have to begin to look at the things that are important. Now, thermographic imaging, okay, remember we said it's a heat signal picker upper? Kind of interesting how I put that, right? But what it does, it's a camera that photographs the expression of heat and or too much coldness that shouldn't be there. So if you have something that's too hot all of a sudden, it's a blood supply that may be developing. So it's called angiogenesis. It means the development of blood vessels. Now, angiogenesis is always there before the tumor shows up. It's always there before the tumor shows up. And a thermographic image can show it 3 to 8 years before the tumor is detectable on mammography. So wouldn't it be great to know early on if something's developing? So in the world of turbo cancers, these cancers that are just showing up out of nowhere, if you will, wouldn't it be good to find out, in fact, that you got something going on, and before it even says, hey, you got a problem? So you know people with cancer are particularly vulnerable to severe disease, and particularly any kind of viral patterns like this COVID-19 that came in, because their immune system is already kicked in the butt, and they need to find out the things that they can do. Now, if you go to Pfizer and their BioNTech, and you look up induced turbo cancers, uh, they're going to tell you that again, it's not so much, that it's just because you already have a weakened immune system and things are kicking in and so forth. But I want to put it in your brain, and I want you to do the homework, but go to all the studies. Don't just stop with the ones that the drug companies are putting out. I want you to go to the journals like Nature. I want you to go to the Townsend Letter. I want you to check the pros and cons and the PubMed and so forth, and really look at them and see what it says. But these turbo cancers are not something that is somebody's fictitious, hallucination, thought process. Uh, it's not that. I promise you, it's not that. We're seeing way too many of them, and the the CDC is telling you that you got a problem. There's 14,000% increase in cancers post-COVID. So could the COVID virus itself be triggering some of this? Maybe, but we know that the vaccine itself is the most problematic piece of the puzzle, and we have to make sure that we understand that. There's several really excellent articles if you get into it. Please do your thing. I met an amazing man recently by the name of Dr. Stephen McCullough, and he's the guy. He's an MD physician. Many of you know him. He put his reputation, his professional life on the line during the COVID period, if you will, and talking about what really was taking place. And another researcher that was talking about how the vaccines and the COVID virus, particularly in long haulers, enter the body and tie up the genome, your DNA, and continues to replicate itself within your body. And then over time, if you're of the childbearing age and you do have a child, if you're lucky enough to be able to get pregnant, if you're lucky enough to be able to impregnate somebody, guys, that manipulated DNA that comes from your body now goes on to your child. And the side effects are that the data is really very clear. Anything short of that is blatantly a cover up, in my opinion, things that are not being reported as they should. But you'll go into, you'll see turbo cancers debunked. Ask the question, who wrote the article? And find out who wrote the article. Next question is, what did they have to gain by writing that article? And the third question is, who paid for them to write the article, directly or indirectly? Those are three questions you should always ask of everything. Who said it? Why did they say it? And what did they gain from saying that? And the third piece is, what is the remuneration? How much money are they getting put in their pocket because they did that? They said that, they wrote about it, They became an advocate for it, and so forth. All those things are important. When you've heard me say, when you listen to any of the talking heads, particularly politically, you have to get curious. You have to dig. One side of the puzzle is going to blatantly lie. Another side of the puzzle is going to lie by omission. It's the same thing here. They're going to perpetuate a platform that is something about what they are trying to get you to believe. Now, so, there was an article, and this goes back to, and I picked it up when I was going through, because I read the fact checks too, as they're trying to debunk it. And they're talking about young people coming up with different types of cancers and the increased rate. And, they lead by saying that the DNA vaccines that they're developing are not inherently dangerous. Bull. I mean, I'm sorry, it's just not true. Anybody that has any plausible understanding of science has to understand that that's a lot of garbage, if you will. So please do your homework. The 11th, join us at the Roselle Center for Healing in Fairfax. What we're going to be doing is we're going to be really putting this into a place of diagnostics. What can you do as a diagnostic tool that is not going to hurt you, meaning no radiation, that is going to be extremely predictable? And then what next steps if something shows up? What can you do and take the next steps? So we're going to show you films, or pictures, if you will, thermographic imaging pictures. We're going to show you the path, if you will, of how to begin to help support your immunological system. What's available? You're smart people. You need to be able to figure it out. And more importantly, we're going to tell you how to, perhaps increase your body's immunological reaction. There's several things out there. There are treatment centers in all places, Mexico, that are amazing. There's cryotherapies where they go in and they freeze the cells so they don't even remove anything. There are things that upregulate immunological response. There are things coming out of out of Canada for years. One's called 714X. Things that we don't know about in this country. Why is that? Why? That's how my brain works. I got to know why. And some of the answers, would make you more angry than listening to, the political debates on television. But bringing up your immune system with energetics, with herbs, with, different types of supplementation. There's lots out there. There's energetic platforms. Again, am I telling you these things fix anything? Nope, that's not what I'm saying to you. What I'm saying to you is that you need to know what things you can do to support your body's recovery, support the possibility of recession. Cancers can go away just like they come about. And some people will tell you that cancer is the last ditch effort to try to protect you before anything else takes place. So join us, okay? And particularly next week when I have Dareth Painter on with me, it's going to be a great program. And we'll make sure that we do reserve your seat. You can do it online. Go to rosellecare.com, or simply go to my website that you go and pick up all these programs on. Go to drtomroselle.com. And that's drtomroselle.com. Register for the class. Call the office if you want to. It's 703-698-7117. And it's exciting. I'm really looking forward to meeting a lot of you that perhaps I haven't met before. And, Dareth is a fountain of information, and she'll be the lead with the thermographic piece. Join me then, and join her then. I'm going to be the guy kind of, interjecting here and there, but I'll actually put some pieces of the puzzle together for you so you really understand, what this thing all comes about. But when it comes to this thermographic imaging, the advantages of breast thermography, trust me, this woman has got it together. She knows it better than anybody could possibly know it. And she has a sense that when something is there, she'll even tell the docs. There's a whole group of MDs that's all they do is read these things all day long. And she works in tandem with them. And I promise you it's going to be a great program. But join us on the 11th. And, until then, remember one simple fact. The reason that we do this, I love you all. Have a great day. Bye.